I'm excited to show you one of my favorite procedures to remove benign moles and also benign lesions such as seborrheic warts or seborrheic keratosis and some skin tags. So if you do have a mole or unwanted lesion in cosmetically sensitive area like perhaps on your nose or your face and you're quite self-conscious about it and you want to remove it without having much scarring, this is the procedure to go to. It's called radiosurgery. So first what we do is we put a local anesthetic under the lesion. I'll explain to you in the diagram. So maybe this is your skin and you have this raised mole here, right? And that's your eyes looking down. So what we do is we first put a little local anesthetic injection to numb the area. After that, what we do is using radio frequency current and a little tip that is attached to this. So this is actually the radiosurgery device, and the tip will be right here, and it goes on to the lesion, and we can actually vaporize it layer by layer until when we feel and visually see that it's been cut flush to the level of the skin. Okay, and the good thing about this procedure is that as we vaporize the lesion, it also seals the little blood vessel underneath it, so you get minimal or no bleeding after the procedure. There is one thing to take note, that a mole is made up of melanocytes, which is pigment producing cells. Okay, what we do not know is whether at this layer, whether there is some residual pigment cells here. It doesn't matter if the pigment cells are down at the bottom. So sometimes I would say in about 10% of the time after the procedure, you could still see a little bit of pigment on the surface, but about 90% of the time you don't see anything. Hi, I'm now going to demonstrate how we do the radiosurgery procedure on the benign mole over here. Now this mole has been anesthetized with local anesthetic and is now ready for the procedure, and you'll see that it's actually quite fast. We start the suction. I usually try not to overcorrect, just when it's smooth, that's enough. And then I just use a bit of hemostasis so that it doesn't have any bleeding. There you go. It's very clean. There's minimal discomfort after the procedure. You have a bit of antibiotic applied onto the wound after the procedure, and you go home. The scab falls off around about 5 days to 7 days, and you're left with minimal or almost not much visual scarring. These are some of the results done by radiosurgery at our clinic. This one's of a benign mole done on the nose, and about 3-4 weeks later. This one's of aging warts on the sideburn, and this one is 4 moles done with radiosurgery on the face about 1 month later. This was a difficult one on the medial canthus of the eye, removed by radiosurgery, and very nice results. So for more information, the best is to make a consult with us, because we have to examine the mole first to make sure it's not cancerous, because the management would be different otherwise.